Hello, everybody. My name is Kay McQueen, and I'm a dietitian in the Healthy Heart program. Myself, and along with my co-workers, Karen Mornan and Simran Fairweather, are presenting this talk today, Fiber is Your Friend. So we are going to talk about what fiber actually is, what are the types of fiber, how much fiber do we actually need, and more importantly, how are we going to get all this fiber in our diet? So dietary fiber is the part of the plant that cannot be digested. And fiber in the diet contributes to our overall health. It helps regulate our bowel movements, manages blood pressure, controls blood sugar, and can assist with weight management. Now, this dietary fiber, of course, may also help prevent chronic diseases such as diabetes, cardiovascular disease, colon cancer, and diverticular disease. There are two major types of dietary fiber, and foods typically contain a mix of both types. I'll get into that a little bit later. And the soluble fiber, that's the fiber that tends to be sticky and gummy, and it actually inhibits the absorption of cholesterol. It assists with controlling our blood sugar levels, and it can also lower our cholesterol levels. And where we find soluble fiber is in many of our foods. Oatmeal is a big one, oat bran, beans and lentils. There's a cereal called All Bran Buds that actually has psyllium added to it. And many of you are familiar with Metamucil. So psyllium is what is in Metamucil, and then psyllium is actually added to the bran buds. Now we need 10 grams of this soluble fiber every day. And unless you are regularly consuming these foods in your diet, it is going to be extremely difficult to get this soluble fiber. So therefore, we're going to ask you to maybe look at some of these foods and how you're going to put them into your diet on a much more regular basis. The other type of fiber is the insoluble fiber, and that's the fiber that keeps you regular. It may help prevent or treat some diseases of the colon. It may also reduce the risk of colon and rectal cancers. And what this insoluble fiber does is increases the bulk of the food and can make you feel fuller, which may cause you to eat a little bit less. So the insoluble fiber, that's the wheat bran. So that's the typical thing you would find in whole grain bread. That's what you would find in, for example, the all bran, which are the little sticks as opposed to the all bran bud that has the psyllium in it. It's in our whole grain pasta, it's in our fruits and our vegetables, it's in our nuts. And you can see that there is a mix of this insoluble fiber and soluble fiber in our foods. But typically, to get that soluble fiber to help lower the cholesterol, again, you need to really key in on those other foods that I just mentioned. All our foods will contain a combination of two of them, and all soluble fiber foods contain insoluble fiber, but not all insoluble fiber foods contain that soluble fiber, or enough of it to make up that 10 grams of fiber every day. So how much fiber total do we need in our diet? And the recommendations are for anywhere from 21 to 38 grams of fiber per day. The men would need on that higher end, the women on that lower end. So how do we get all this fiber into our diet? That's the next question. Now, fortunately, all our foods do contain nutrition facts, and I've highlighted a couple of things here. I've highlighted Silver Hills bread. Every one slice has 5 grams of fiber, and in these all bran buds, just 1/3 of a cup has 11 grams of fiber. Okay, so really start taking a look when you pick up your cereals, when you pick up your crackers, when you look at your breads, take a look at how much dietary fiber is in the food and what your serving size would need to be. So just that 1/3 cup of all bran buds can help you meet almost half your needs of dietary fiber for the day. So if you're going to be eating cereals for breakfast, You obviously have to be eating breakfast, and I can't emphasize that enough. It is very important to eat breakfast. It's going to be a little more difficult if you're somebody who's not regularly eating breakfast to get all this fiber that you need in your diet. And that's because a lot of these foods that we're mentioning here are certainly would be breakfast cereals. So our oatmeal, our porridge oats or oat bran can provide anywhere from 3 to 6 grams of fiber per serving. Just 2 slices of this swirly bread is going to give you 10 grams of fiber. We haven't even talked about the banana that's in there, those few nuts. So that's also another great option for you to get more fiber into your routine. And look at all these cereals. Here are 4 cereals that have at least 10 grams or more per serving. And those servings are anywhere from 1/2 to 3/4 of a cup. So it is doable, but oftentimes breakfast is going to be quite important. I guess in reality also, breakfast cereals, some people do have a snack before bed. And if you're somebody who isn't quite getting breakfast regularly, I might suggest a cereal, a bowl of cereal and low-fat milk for your nighttime snack to help you get some of these higher fiber foods in your routine. Vegetables and fruit. We have an entire presentation on fruits and vegetables, but I'm just going to really emphasize that every serving of fruit and vegetable is going to give you anywhere from 2 to 5 grams of fiber per serving. Now, we want, for health benefits, people need at least 5 servings of fruits and vegetables every day. I usually promote at least 7. So what's a serving? A serving is 1 apple, 1 pear, 1 orange, a handful of grapes. And how big a handful of grapes? Think about the size of a tennis ball. For vegetables, it's 1 cup of leafy greens. It's 1/2 cup of cooked vegetables. If you like your broccoli and cauliflower, you would need to have 4, asparagus 6. So really, 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 I can't emphasize enough how important it is to eat your fruits and your vegetables every day. Again, if you're not eating regular meals, it is, again, difficult to get all of these fruits and vegetables into your routine. If you're somebody that eats maybe 1 or 2 meals a day, it's going to be very difficult. So again, you can add fruit at your breakfast, on your cereal. Fruit makes a great snack. You can have, make sure you have vegetables at least twice a day with your lunch and your dinner, or as a snack and dinner. So fruits and vegetables, extremely important as part of a heart healthy diet, extremely important to help you reach your fiber needs. At lunch and supper, we always want to choose more whole grains. We've got the whole grain tortillas here, if you like a wrap, for example. How many of you have tried quinoa? How about beans and lentils? How about whole grain pasta? All our potatoes. Make sure you keep the skin on the potatoes. Pearl barley. Now, barley is also something that people aren't always familiar with, but barley, people put it in beef and barley soup, but why not as a side dish as well, instead of refined processed pasta and rice? Beans and lentils. This is a tricky one. Really important to consider adding these into your routine. First of all, they're great sources of plant-based proteins. Secondly, they're very high in fiber. Thirdly, they're very, very low in fat. But a lot of people are afraid of these foods. They're concerned about gas, which are legitimate concerns. But I think if you start to think about how you can add them into your diet on a little bit more controlled and in controlled amounts, you'll see that you can actually start to enjoy these foods. You can include them at breakfast, at snacks, salads, soups, desserts. If you've never used them, you could consider adding 1/2 cup of black beans to a salad. You could try vegetarian chili. But just when you do start to add these foods, take it slow. Don't make a great big huge batch of bean or pea soup and then eat it for 3 days and say, oh my gosh, I'm too uncomfortable. I can't, I've got too much gas and too much bloating. I can't eat these again, okay? So take it very slowly, but even if it's just, for example, some hummus with some vegetables to dip in, Again, small portions, add slowly. But this particular website is a great website to find out how you can start to explore using these beans and lentils. Here's an example of one of the soups. Soups are fairly straightforward to make. I haven't given you the whole recipe. These are the ingredients here, but take a look online, and this would be the website to go look for those great recipes. And I would encourage you, you often hear about Meatless Mondays. Start thinking about how you can add just 1 or 2 servings in a week just to get accustomed to incorporating these into your diet. And I think the benefits will be significant. We can also enjoy foods at snacks that are going to give us this whole grain fiber. Look at these crackers, the Rivita and Wasa crackers. If you're gluten-free or celiac disease, Mary's has some good crackers. Nuts are an excellent snack choice. About 1/4 cup every day is recommended. There's some hummus there. Dip some veggies into your hummus if you're one of those people trying to increase your vegetables as opposed to the crackers. And Fin Crisp is also another great cracker that you can look at. So when you are shopping out there, I really want you to start taking note of the fiber content of some of these foods and try to aim for at least 3 grams of fiber per serving. And I think if you can start to do that, I think you'll get a lot closer to getting all that fiber in your diet that you actually need. Just 3 servings per day of whole grains have been shown to reduce heart disease by up to 30%. And other whole grains include barley, quinoa, whole wheat pasta. So really see what you can do to increase these foods in our diet. This goes without saying, and it's a pretty obvious slide. It speaks volumes. Avoid these white foods. So a lot of people give carbohydrates a bad name, and it is because of this. If we're eating a lot of refined processed foods, really are not going to be beneficial from a heart health perspective. These foods have, we call them, have a high glycemic index, and that means that carbohydrates or the sugar gets into your bloodstream very quickly. This type of eating can increase the risk of heart disease, not to mention concerns around people with diabetes. So whole grains, we definitely want people to avoid all these sugar sweetened beverages, even adding that sugar to your coffee. We would recommend you limit and avoid. And even drinking juices, always eat the fruit. You're always going to get the benefit. So eat your fruits and vegetables, don't drink them. And finally, I just want to close with this great slide. This is the Canada's Food Guide. It's been out for a couple of years now, and I think they've really simplified it for us. Remember, we want half our plate to be all our vegetables. We want some lean protein foods. You can see in here that they've included some beans and lentils into our diet. And on the topic here, even some nuts are going to add a little bit of that protein for us. It doesn't have to be this great big huge piece of meat sitting on our plate. Our low-fat dairy products also provide protein as well. Look at this. 1/4 of our plate should be our carbohydrates and our whole grains. You can put your potato in this section as well for carbohydrate source. People are afraid of these foods. You shouldn't be afraid of them. You can enjoy them. We just want them to be in that whole grain fashion. And in a little bit smaller portions. I think we're used to a plate of pasta, a plate of rice. And I think we need to start balancing things out a little bit. So lots of our vegetables, look at that wonderful color. Some nice lean protein, some plant-based proteins, and some heavy, hearty whole grains to put into our diet to round out, to make a heart healthy diet. And just a healthy diet in general. It's great for the whole family. You shouldn't really need to have separate meals for the rest of the family because everybody is going to be benefiting from eating heart healthy diet. Thank you very much. We hope you enjoyed this.